Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and our today's topic of infectious medicine is babesiosis. This topic we will cover in three different sections. In the first section, we will talk about Babesia microti, and this is the most common causative organism of babesiosis. So we will talk in detail about the incidence of babesiosis and Babesia microti, etiology of babesiosis and mode of transmission, how this infection can spread, and then what's the pathophysiology and what's the process by which the infection spread. So in the first section, we will cover the babesiosis as a whole and also one specific organism, which is Babesia microti, which is the most common organism causing babesiosis. So both will be covered in this section. Then in the second section, we will discuss the Babesia infection, asymptomatic Babesia microti infection, mild to moderate infection, severe infection, and then we will discuss some other Babesia infections. So as I mentioned in the first section, we will talk about the incidence, etiology, pathophysiology of Babesia microti, which is the most common causative organism, but it's not the only causative organism. We have some other Babesia species that can cause babesiosis, and that we will discuss in this second section. And besides that, we will talk about the different types, mild, moderate, and severe Babesia microti infection in the second section also. So that will cover basically all the Babesia microti and some other Babesia infections. Then in the third and final section, we will cover the diagnosis, how we can diagnose babesiosis, what are some lab tests, specific lab tests for the Babesia infection, and then also besides that some other non-specific tests which can be performed as a routine for different infections. Then we will discuss the treatment of Babesia microti, and also we will discuss the treatment of other Babesia species infections, and then we will discuss the prevention of Babesia also, or babesiosis. So all that we will discuss in today's topic. So keep watching sqadia.com.